All right, Dr. Williams, you had a question. Someone went to get Botox and they got it done in their eyebrow and they had concern for that. What can you say about this? Is this normal?
Yeah, so that's a little bit more advanced technique. You certainly need to understand what you're doing when you do that. It's not a beginner level thing. And let me just explain a little bit. The muscles up here, this is called the frontalis muscle. And these muscles pull the eyebrows up, okay? Then you have the orbicularis oculi, which is the round muscle around both eyes. That is a depressor. It brings the eyebrows down. And so typically what we do is, from a basic standpoint, we Botox this area, the corrugators and the procerus. Again, these bring the eyebrow in and down. So if we paralyze these, we also want to paralyze these to balance them out, because these muscles and these muscles work in opposite directions. The simple technique is we go in, we stay inside the pupils, Botox here, and we Botox here. What that does for women is it creates a little bit of a lateral brow lift, which most women want. Men, doesn't really matter. We like flat brows. That's what's natural for a man. Sometimes if you stay inside the pupils, depending on the individual, they will still have a crease here. And so even though they got a brow lift, they still got a wrinkle there, and they don't like that. So we can come back in, we actually paralyze those muscles. Well, what happens at that point? It gets rid of this wrinkle, but it causes the brow to droop, and women want to lift. So we come back in here, slightly paralyze the orbicularis oculi that's responsible for bringing your brows down. When you do this, you get a lift from it. To be very careful, Botox can diffuse into the levator palpebrae superioris, which is the muscle that keeps your eyelid elevated and opened. And so if you inject here and you don't know what you're doing, it's going to diffuse into that area and you're going to get lid lag. And so one eye potentially is open and you're walking around with one eye drooping. So to answer your question, sum all that up, yes, that is a normal technique, but be careful. Again, that is an advanced technique that only advanced injectors should be using. Thanks for tuning in for this episode. Just a little preview. Next week, we're going to talk about NAD use. You're seeing it advertised everywhere. Everyone wants it. There are some dangers, and so we're going to go in depth on that and try to educate you more. Stay tuned.